Welcome to the deep dive. Today, we're looking into something really quite important for many of you listening, particularly those in the 22q11.2 deletion syndrome community, and of course, your families.
That's right.
We're going to explore a recent study. It's one that seems to have found a potential link between 22q and Parkinson's disease.
Yes, it's a study by von Scheibler and colleagues published in Movement Disorders Clinical Practice. And it really does offer some crucial insights.
Absolutely. So, our mission today really is to unpack that. We want to give you a clear understanding of what the study found and, importantly, talk about some practical, actionable things to consider based on this information.
Exactly. Let's try and make sense of it.
Okay, so maybe we should start with the basics first. Just briefly, for anyone perhaps less familiar, what exactly is 22q11.2 deletion syndrome?
Sure. So 22q, as it's often called, is a neurodevelopmental condition. It happens because there's a small piece missing from chromosome 22.
And it's actually surprisingly common, isn't it?
It is. The estimated birth prevalence is around 1 inch, well, just over 2,000 births. So, yeah, it's more common than many people might think.
Okay. So let's get to the study itself, the one by von Scheibler et al. What was the big finding regarding Parkinson's?
The main takeaway, really, is that they found a significantly higher rate or prevalence of Parkinson's disease in adults with 22q compared to what you'd expect in the general population.
Higher rate. How much higher are we talking?
Well, overall, in their study sample, they found Parkinson's in about 1.8% of the individuals with 22q.
1.8%. Okay.
But here's where it gets quite striking. When they look specifically at the older individuals in the study, those age 50 and over, that number jumped a lot. It went up to 14.0%.
14%. Wow, that's a huge difference compared to 1.8%.
It really is. It strongly suggests that age is a significant factor in this link within the 22q population.
So as people with 22q get older, their risk seems to increase quite a bit. Any idea why that might be?
Well, the study doesn't give us a definitive why, but it certainly highlights this trend. It's possible the genetic changes in 22q might make the brain perhaps more susceptible over time to the kinds of changes that lead to Parkinson's. But that's still something needing more research.
Right, okay. And did the study say anything about what Parkinson's looks like in people with 22q? Is it different?
Interestingly, they found it can look quite similar to typical Parkinson's disease.
So the classic symptoms.
Yes, exactly. Things like slowness of movement, bradykinesia is the medical term, or a tremor when someone's resting, like a hand shaking in their lap, and maybe rigidity or stiffness.
Okay.
And importantly, they also noted that these individuals often respond well to levodopa treatment.
Ah, the standard Parkinson's medication? That's good to know.
It is. It suggests the underlying mechanism might be, related to dopamine, just like in typical Parkinson's.
Now, you mentioned age earlier. Did the study find anything about the age when symptoms start?
Yes, and that's another really key point. The average age for motor symptoms starting was around 45 years old in the 22q group.
45? That seems early.
It is. It's definitely earlier than the typical Parkinson's onset, which is usually, over 60. And some people in the study even started showing symptoms before they turned 40.
Wow, before 40. That's really young for Parkinson's.
That is. And this earlier onset is a very significant finding.
The researchers also seem to suggest that diagnosing Parkinson's in this group might be a bit complex sometimes. Why would that be?
Yeah, there can be some challenges. For one thing, some medications sometimes used for other issues related to 22q, like certain antipsychotics, can unfortunately cause side effects that mimic Parkinson's symptoms, like stiffness or slowness.
Ah, okay. So that can muddy the waters.
Exactly. Plus, 22q itself can come with various neuropsychiatric features, and sometimes it can be hard to sort of tease out what's related to Parkinson's versus something else. They even talked about cases of uncertain PD in this study.
Uncertain PD, meaning they suspected it, but couldn't be totally sure.
Precisely. Which highlights the need for careful evaluation.
Okay, so putting this all together, for our listeners, maybe a parent with a child with 22q or an adult with 22q themselves, what's the main message they should take away from this study?
I think the biggest thing is simply awareness. Knowing that there seems to be this increased risk of Parkinson's as individuals with 22q get older. Doesn't mean it will happen, of course not, but it's something to have on the radar.
Right. So practically speaking, if you've just had a diagnosis of 22q in the family, or maybe you've known for years, what should you do differently now, knowing this?
Well, I think the most crucial thing is open communication. Talk to your doctors, your healthcare team. Make sure they're aware of this potential link highlighted by the study.
And be specific about symptoms.
Absolutely. Don't ignore or downplay any new motor symptoms. Even if it seems subtle, maybe a change in coordination, bit of new stiffness, slight tremor, mention it. Early reporting is key.
What about things at home? Is there anything families can do day to day?
Well, the study doesn't give us, like, a magic bullet for prevention in this context.
Yeah.
But supporting overall well-being is always a good strategy, isn't it?
True. Like healthy lifestyle things.
Yeah, exactly. Encouraging a balanced diet, finding ways to stay physically active that work for the individual, good sleep. All those things support general health.
Mm.
And again, just being observant for any motor changes and reporting them.
Makes sense. And thinking about school or work environments.
It's useful to be aware that if some of these early motor changes do start, they could potentially affect daily activities. Maybe tasks needing fine motor skills become trickier, or perhaps there's a general slowness.
So be ready to advocate for support if needed.
Yes, definitely. If difficulties arise, knowing about this potential link can help in conversations about getting the right accommodations or support in place. Early intervention there can make a difference too.
Okay. So how do people actually access the right kind of help? If they notice concerning symptoms, what's the pathway?
This study actually makes a specific recommendation here. They suggest that healthcare providers should think about doing periodic systematic motor exams for people with 22q, maybe starting around age 40.
Regular checkups specifically looking for these motor signs.
Kind of, yeah.
Yeah.
And if any signs suggestive of Parkinsonism, those Parkinson's-like motor symptoms are spotted, then a referral to a neurologist is really important, and ideally one who specializes in movement disorders.
A movement disorder specialist. Why is that specific referral so important?
Because they have the focused expertise. They can properly assess the symptoms, help figure out if it really is Parkinson's versus, say, a medication side effect or something else, and guide the right diagnostic steps and treatment.
And catching it early. What are the benefits there?
Several things. One, it allows doctors to get a baseline, to see where things are starting from, which helps track any changes over time much better.
Right, tracking progression.
Exactly. And it also means getting access to appropriate management strategies much sooner. Plus, it's just really important that patients and families know about the risk so they can be partners in watching for signs and seeking help promptly.
So just to recap the main point from this deep dive into the von Scheibler study, it seems individuals with 22q11.2 deletion syndrome do have a higher chance of developing Parkinson's and potentially at a younger age than usual.
Yes, that's the core finding. But, the goal here isn't to cause alarm. It's about empowerment through knowledge.
Right. Knowing allows for action.
Precisely. Being aware means you can be more watchful, you can engage in monitoring, and you can seek help early if needed. And that early intervention can really impact management and quality of life down the line.
So we definitely encourage you, our listeners, to take this information and discuss it with your own healthcare providers. They can give you advice tailored to your specific circumstances.
Absolutely. And maybe just one final thought to leave you with.
Go on.
Since 22q seems linked to this earlier Parkinson's risk, it actually presents a really unique window for researchers, doesn't it? A chance to study the very, very early processes of Parkinson's disease.
Like studying it before it typically starts in the general population.
Exactly. So the provocative question is, what could we learn by studying Parkinson's in the context of 22q that might unlock new understanding or maybe even preventative or treatment strategies, not just for this group, but potentially for everyone affected by Parkinson's disease?
That's a fascinating angle. Food for thought indeed.